Hello everyone. In this video, we will be discussing how to manage your blood pressure at home.
The topics we will cover throughout this video include what is blood pressure, how to properly take your blood pressure, complications, and at-home treatments. Hello Senior Center. My name is Drew. I'm from the FSU College of Nursing. Today we're going to talk about blood pressure. So what exactly is blood pressure? Blood pressure is the force of blood against your artery walls. There are two readings which measure blood pressure. On the top here, we have your systolic pressure. This is the higher number. It measures the force of blood being pushed around your body when your heart contracts. On the bottom here, we have your diastolic pressure. This is the lower number. It measures the pressure inside your arteries when the heart relaxes between beats. So which of these numbers are more important? While both are important, more attention is often given to the systolic pressure, the number on top. This can indicate a major risk factor for cardiovascular disease in people over 50. As you age, your arteries become more stiff and you have more plaque buildup. So your systolic may rise as you get older.
The only way to know if you have high blood pressure is to have your blood pressure tested. Understanding your results is key to controlling high blood pressure. This chart shows what's considered normal as recommended by the American Heart Association. There are 5 blood pressure categories recognized by the American Heart Association. These are normal, elevated, hypertension stage 1, hypertension stage 2, and hypertensive crisis. Blood pressure numbers of less than 120/80 millimeters of mercury are considered within the normal range. If your results fall into this category, stick with heart-healthy habits like following a balanced diet and getting regular exercise. Elevated blood pressure is when readings consistently range from 120 to 129 systolic and less than 80 millimeters of mercury diastolic. People with elevated blood pressure are likely to develop high blood pressure unless steps are taken to control the condition. Hypertension stage 1 is when blood pressure consistently ranges from 130 to 139 systolic or 80 to 89 millimeters of mercury diastolic. Hypertension stage 2 is when blood pressure consistently ranges greater than 140 systolic over 90 millimeters of mercury diastolic. If your blood pressure readings suddenly exceed 180 systolic over 120 millimeters of mercury diastolic, wait 5 minutes and then test your blood pressure again. If your readings are still unusually high, contact your doctor immediately. You could be experiencing a hypertensive crisis. So why do we worry about high blood pressure? When your blood pressure stays high over time, it causes the heart to pump harder and work overtime, possibly leading to serious health problems such as heart attack, stroke, heart failure, and kidney failure.
Now let's review. Blood pressure is the force exerted against arterial walls as the heart pumps blood. The systolic blood pressure, which is the number on top, is the pressure exerted as the heart contracts during a heartbeat. The number on the bottom is the diastolic blood pressure. This is the pressure exerted when the heart is at rest between heartbeats. A normal blood pressure is less than 120 millimeters mercury over 80 millimeters mercury. Any blood pressure reading over 120/80 is considered high blood pressure. This can put you at risk for many different diseases.
In this segment, we're going to take you through what you need to take your blood pressure at home and some things you should look out for. First, here we have a stethoscope and a blood pressure cuff. To take your blood pressure at home, you may need some assistance, but you're going to begin by placing the blood pressure cuff around the upper arm, taking note that this is on the inside of your arm near your brachial artery. Make sure to rest your arm on the table so you aren't holding it up, which can increase your blood pressure. You want to place your stethoscope under the cuff of the blood pressure right on your artery. As you begin to pump up the cuff, you can see the numbers increasing, and you should stop at approximately 160 and let it begin to release. You should be listening and watching as it releases so you can take note of when the sounds stop and they start, which is equivalent to your systolic and diastolic blood pressure. Bria's blood pressure was 126/86, which is fabulous. If you don't have a stethoscope and blood pressure cuff at home, you can go to somewhere like CVS or Walgreens, and they have automatic ones in the pharmacy section. You may also be able to buy an electronic monitor from the pharmacy or your doctor. Some things to note when you're taking your blood pressure is you should make sure your feet are flat on the floor and your legs are not crossed, as this could cause your blood pressure reading to go up or down. There are some things that can make your blood pressure reading inaccurately high, like having too big of a cuff or too small of a cuff. Also, if you are crossed or holding your arm above your heart, this will increase your blood pressure. Some things that may make your blood pressure lower include too wide or too loose of a cuff, because the squeeze from the cuff will be inaccurate. So, for best reading, again, make sure your feet are flat on the floor and your arms are relaxed when taking blood pressure. There are some things that can cause your blood pressure to raise right after doing them. So to get an accurate reading, you should avoid taking your blood pressure right after you've exercised or went on a long run, after you've smoked or drank caffeine, and also some things that can cause your blood pressure to be inaccurately low is if you are dehydrated and have a low fluid volume.
To review, these are some things you should do before, during, and after you check your blood pressure, whether you're at home or in the clinic. In the 30 minutes before your blood pressure is taken, avoid smoking, caffeine, and exercise. In the 5 minutes before your blood pressure is taken, sit still. While taking your blood pressure, be sure that the cuff is the right size and in the right place. Keep your cuffed arm on a flat surface like a table and at heart level. Sit upright, back straight, feet flat on the floor, and don't talk. If you need to retake your blood pressure, wait 1 minute before you take it again. Remember to keep a log documenting all of your blood pressures to bring to your next checkup with your physician. We all know that technology doesn't always work perfectly, so be sure to bring your blood pressure taking device to your physician at least once yearly so they can check to ensure it is working accurately.
So now that you know the normal values for blood pressure and how to take your own blood pressure, we are now going to discuss the complications that can arise if your blood pressure is too high or too low. So high blood pressure is often labeled as the silent killer because most people with high blood pressure may have no symptoms at all, even if their levels are dangerously high, which is why it's important to have your blood pressure checked frequently. A few people with high blood pressure may have symptoms such as headache, shortness of breath, or nosebleeds, but these usually occur when blood pressure has reached a dangerous stage, which again is why you should have your blood pressure checked often before it gets dangerously high levels. When your blood pressure rises too high, the blood vessels in your body may become damaged over time. The longer that high blood pressure is uncontrolled, the greater damage is that can occur in your organs. Some complications of uncontrolled high blood pressure are heart attack, stroke, aneurysm, heart failure, kidney damage, and even vision loss.
Now that we've learned about the complications that can occur with high blood pressure, we're going to talk about the complications that can occur with low blood pressure. Oftentimes people think that low blood pressure is a good thing, and most of the time they're right. People with high blood pressure are often put on medications by their doctors so that their blood pressure can be lowered into a normal range. But sometimes your blood pressure can be dangerously low. Severely low blood pressure can deprive your body of the necessary oxygen that it needs to function properly. Some of the signs that can indicate a blood pressure that is too low are dizziness or lightheadedness, fainting, lack of concentration, blurred vision, cold and clammy or pale skin, rapid or shallow breathing, fatigue, and nausea. If you experience any of these signs or symptoms I just listed, it's important to make an appointment and see your healthcare provider. While you're waiting to get in to see your healthcare provider, you should also try and keep a journal. This journal should include not only just the symptoms that you experienced, but it should also include what you were doing right before you experienced these symptoms. Doing this will help your doctor in determining the underlying cause of your severely low blood pressure, as well as the best way to treat your low blood pressure. Next, we're going to talk about home treatments and interventions that you can implement in your daily life to help control your blood pressure.
Alright, so I want to talk about some things that we're able to do at home on our own to help decrease and lower our blood pressure. So we're going to talk about diet, exercise, stress, smoking, and alcohol. So when I say heart-healthy diet, what is it that comes to mind? So fruits, veggies, beans, whole grains, low-fat dairy, nuts, and that's a balanced diet. And then while we have that, we also want to limit our intake of sugars, salts, and then the bad fats, so the saturated and trans fats. So one way that we can do that, to kind of figure out what we need to be eating or what might be helpful to us, is keeping a food diary. So this is really simple, it doesn't have to be complex. So that can be as easy as just writing it out on a piece of paper, keeping it online in a Word document, or there are some online websites and apps you can use to kind of track your calories, your sugars and fats and carbs, and all those kinds of things with each meal. So just an example, this is an example of a food diary template. This was free online. This is very simple. This just tells you breakfast, lunch, dinner, the meals, and then across this way is the days of the week. So this is basically you're just tracking kind of what are the foods I'm consuming. And then you can get something a little bit more complex like this, and this has each day are these horizontal bars, and within that you can put what you're eating, and this one tracks serving size, protein, carb, sugar, fat, and calories. So this is just a little bit more in depth of how you could track your food, and this tracks kind of some of the nutritional value. So there's not really a right or wrong, it's just kind of whatever works best for you. And you want to make sure that when you are shopping, you're looking at the nutritional labels in the store. So when you're looking at this, we're looking for the bad fats. So we don't want to see trans fats or saturated fats. We're looking at cholesterol. We don't really want to have a lot of cholesterol. And some products will even have on the label, like this has got a heart healthy logo on it. So this, easy to see on the shelf, this would be good for a heart healthy diet. Good to go. So we want to eat also like leafy greens, fruits, very good, high in antioxidants. You want to eat fish, dark chocolate's okay, nuts, beans are really good, avocados are good fats. So with the fish, I know that a healthy heart on a budget can be difficult sometimes. So even getting something like this, canned tuna, this is canned tuna in water, very good for you. You're still going to get the omega-3s that you need from it. It's relatively cheap. You know, there's canned sardines. There's all sorts of canned fish proteins that you can get for a relatively cheap price. So that's a good option. And then as far as beans go, buying beans in a can, totally fine. Buying frozen beans, frozen veggies, totally fine. So if you are going to be buying beans in can or veggies in cans, look for low sodium or rinse them before you use them. Frozen veggies still keep all the nutrients that you need. They can just be a little bit more accessible for some, maybe cheaper, easier to use, easier to make and prepare. That can be a big thing. So that's kind of diet. And then let's look at stress. So we all have stress, we all know stress. So chronic stress over long periods of time can lead to an increase in blood pressure. However, so can occasional stress. Also lead us to those bad eating habits, lack of exercise, maybe drinking, smoking, going to the store and getting that bag of chips or that cake or the processed foods just because it's stress eating, you know. So that's how occasional stress can increase the blood pressure kind of long term. So things we want to do to cope with our stress, some things so we can change our expectations. So really realizing and understanding that we can't change other people, we can only change how we react and respond to other people. And then finding something that relaxes you. So Maybe that's playing golf, maybe that's swimming, maybe that's music or friends and family. Maybe that's going for a walk, cooking something. There's lots and lots of things out there. Picking up a new hobby, doing a puzzle, trying something new. Anything really that you can do that helps to reduce that stress, kind of calms you down. One thing that also helps me with stress sometimes, it's breathing techniques. So I'm actually going to teach you a quick breathing pattern, a quick breathing technique. So I call this a square technique. So what we're going to do is we're going to breathe in for 4 seconds, and then we're going to hold that for 4 seconds, breathe out for 4 seconds, and then hold that for 4 seconds. So I call it a square because I like to use my finger in this pattern to remind me what step I'm on. So let's go ahead and do it. So we're going to go ahead and breathe in, hold it, breathe out, and hold it. And again. Hold it, breathe out, and hold that. So I like to do that maybe 3 or 4 times, 5 times in a row. And that kind of helps my body settle and relax and kind of reduce some of that stress. So that's a good coping mechanism that works for some people. So then the next thing we're going to talk about is going to be exercise. So we all know that exercise is really important. It's recommended that we get about 150 minutes of exercise per week. To make that a little less scary, I would say about 30 minutes of exercise most days of the week. This doesn't have to be, heavy weightlifting, strength training, high intensity. This can be as simple as taking a walk outside for 30 minutes 4 or 5 days a week. So walking is actually really good for our cardiovascular health, really can help reduce blood pressure. Maybe you're swimming, that's really good cardiovascular health exercise as well. Dancing. If you are going to do, maybe you like to do a little bit more weights or kind of muscles toning, muscle strengthening. They recommend doing that about 2 days a week, and then the other 3 days doing some sort of cardio. Like I said, even if it's walking outside. So exercise, very good for us for reducing blood pressure. So the last 2 things I'm going to talk about real quick. We're going to talk about alcohol and smoking. So alcohol increases blood pressure. So having a glass of wine a day is not going to drastically increase your blood pressure. If we drink in moderation, it should be okay. So moderation defined is 1 glass for women and 2 glasses for men per day. However, once we start drinking outside of those parameters, the protective effect of alcohol wears off, and now you're just going to increase your blood pressure. So if your habit is to drink a glass or 2 of scotch 4 or 5 nights a week, maybe you drink 1 glass 2 days a week instead of 5. Just little things like that. So it's not about cutting everything out cold turkey and stopping. It's about little changes in moderation, kind of day to day, to see how we can kind of lower the blood pressure this way. Then smoking is the last thing. So smoking increases our blood pressure, and while we're smoking a cigarette, the blood pressure increases, and then it continues to stay increased for some time after you've finished just that 1 cigarette. So a lot of the thing that kind of makes it hard for people to quit smoking is the habitual pattern, the nicotine, and kind of the feeling they get from smoking, So there are products. Nicorette is a nicotine gum. Nicoderm is a nicotine patch. They have hard candies and lozenges and things like that to help curb the nicotine withdrawal. And then a lot of people I've heard, maybe they hold a pen in their hand for the day, and they're just doing that. Or they have a toothpick in their mouth, or a sucker or lollipop or something in their mouth. So it kind of gives them the physical feel of having that cigarette in their hand, or that thing in their hand or in their mouth, or things like that. So that can kind of help with the smoking cessation aspect as well. So overall, we've kind of talked about interventions we can do at home and the importance of doing them. A big thing too with the interventions is to not try to do everything all at once and cut everything out all at once. It's, like I said, to do things in moderation and start slow and kind of build up and change the habits as you go. So we've kind of talked about what blood pressure is, We've talked about how to take your blood pressure. We've talked about why it's important to take your blood pressure, how to know if your blood pressure is normal or abnormal. We've talked about a lot of good stuff in this video. So I'm going to leave you with that. And if you guys have anything to add or questions, go ahead and submit it on the Facebook page. We'll be monitoring and can try to answer some of your guys' questions later on today. So thank you.
If you have high blood pressure and the interventions you are doing at home, such as eating a healthy diet and exercise, do not effectively help lower your high blood pressure, a healthcare provider may prescribe some medications to help lower your blood pressure. I will briefly discuss some of the common categories of blood pressure medications so that you have a better understanding of how these work in your body to help lower your blood pressure. So diuretics is the first category, and these help your body eliminate sodium in water, which reduces the blood volume and results in decreased blood pressure. The next category is ACE inhibitors, and these work by relaxing the blood vessels to help lower blood pressure. And this group of medications end in PRIL or pril, and an example is lisinopril. The next category is calcium channel blockers, and these also relax blood vessels, but they work by reducing the amount of calcium that enters cells. So then the next category is beta blockers, and these decrease heart rate and the force of contraction of the heart. And this group of medications ends in OLOL or OLOL, and an example is metoprolol. The last category is ARBs or angiotensin II receptor blockers, and these work similar to ACE inhibitors in the way that they relax blood vessels to help lower the blood pressure. So some common side effects of blood pressure medications include cough, dizziness, nausea or vomiting, nervousness, diarrhea or constipation, erection problems, weight loss or weight gain, or fatigue. And these should be reported to your healthcare provider, especially if they are causing you issues. The healthcare provider may be able to adjust your dose, which can decrease the side effects that you experience. So it is important to adhere to your medication schedule and take your medications as prescribed. Don't stop taking these medications suddenly, and always talk to your healthcare provider first.
This video is for educational purposes only. Contact your healthcare provider if you have any issues. Thank you for watching and have a great day.